Sarah.
Good morning. My name is Sarah Kremsner. I'm the Chief Performance Officer for Chicago Public Schools. And in this role, I'm kind of primarily responsible for creating and institutionalizing. Is that better? Do I need to start over? Institutionalizing a culture of performance. And people at Chicago Public Schools, people ask what that means. It sounds like rhetoric. So just really quickly, what that means is really quite simply trying to create a culture of looking at data, making data-driven decisions, and ensuring that the money that we're spending, the resources that we're allocating, and the energy that we're expending is directly linked to positive student outcomes across the district. So whether this be in a central office department, or in an area cluster, or literally in the classroom, we want to make sure that what we're doing is positively impacting kids. So there's a lot of work around that, and what I wanted to do is spend just a second giving you all some context for what student performance at CPS does mean. So increasingly over the last year, what this work has really revolved around is creating student assessment systems, quarterly growth assessments that really give teachers and school-based personnel real-time information about whether or not their individual students are growing at an adequate rate while they're in the classroom with that teacher. When we first came on board at CPS in February of '09, we asked what we thought was a very simple question, which is what is the slope of the line from kindergarten to the 12th grade that we expect our students to stay on, and if they remain on track over the course of those years, that with the diploma in hand, they will launch into the world career ready and college ready. So what's the slope of that line? And people kind of looked at us and scratched their heads and kind of glazed looks. And that's not a criticism of anyone. It's not a criticism of Chicago Public Schools. It's not a criticism of Illinois. I think the system that we all live in has not asked that question in that way, and we had not actually done the work to develop a way to understand that question. And so a lot of what we've been doing is really trying to get an answer to that. Of course, the national standards in the Obama administration and Arne Duncan in DC are doing a phenomenal job to help us answer that question on a federal level, because it is, in fact, I think, the key question. So we're getting there. But what we know is that if we don't give teachers tools and we don't capacity build in the classroom so that people can have access to data that tells them on an individual level, student by student, not aggregate, 410,000 students big, whether or not students are growing at the right rate, what they know, what they don't know, and how to keep them on track, then we will have lost the battle. And so one of the things that we know, and Dr. Cook just gave us a lot of national information about this being the case, is that hunger and access to high quality and nutritious food is absolutely one of the things that impacts whether or not a student stays on that slope, right? So as students start to dip off, or in some cases exceed, that is one of the issues. And the research that links poverty to food insecurity and learning in the classroom, which is also linked, obviously, I just learned so much about the brain. It shows us that CPS students are absolutely at risk, right? So I'm going to give just a couple of CPS statistics. I can't help it. I have to give some stats. 86% of all students qualify for free or reduced meals. So those are the qualifications that Kate was just talking about. So it's a vast majority of our student body. So I'm going to give you some student outcome data, and I wish it was better than what we've heard so far. It's also very sobering. So on the state ISAT assessment, which is the high stakes test that the state gives that kind of tells us whether or not students are likely to exceed in the world. In math, 74% of students who are eligible for free and reduced meals meet or exceed those state standards. So 74%, as compared to 92% of students who are not eligible. So that's about 18% point percent difference. It's substantial. 66% of free and reduced meal eligible students meet or exceed the state standards in reading. This is compared to 89%. So you've got 66% and 89%. That's a 23% difference. The worst stat deals with college readiness. So we at CPS have a minimum threshold of 20 on the ACT as meeting college readiness. It's a pretty low bar, to be honest, but that's our goal. 19% of our free and reduced meal eligible students score 20 or above on the ACT, compared with 57% of students who are not eligible. So there's a big delta there, obviously a lot to be done. We have made real progress, I think, over the last 5 years, and I want to publicly acknowledge Louise Essian, who is our Director of Nutrition at CPS. She's phenomenal. She's a steadfast advocate for kids. And has been a true leader in this realm. Our percentage of participation for breakfast in a universal breakfast has grown from 22% in 2006 to 34%. So it's a bounce. Percent of students participating in lunch has grown smaller, but has grown 76% to 78%. Clearly more to be done. We're really excited. We adopted new nutritional standards this year, finally. I'm sure a lot of you are thinking, finally, that exceed the USDA gold standard, and we're really excited about this. I think this is going to be make a real difference, but there's a lot more to be done. We need to continue to grow our partnerships and bolster our partnerships with external partners and many of you here today. And we need to continue to remove barriers. There are more students who are eligible than students who are participating. So really getting smart about these barriers and being a lot more innovative about the way that we provide services is absolutely a key piece. We're getting smarter, I think, with Kate and her team about some of these pilot projects that I know we'll probably talk more about today, that are very, very exciting and I think are showing a lot of promise. But we need to be more innovative, and we need to really be focused. So going back to that whole data-driven thing, we have to be focused on where the real need is, right? So I think there's a lot of data there. We're constantly parsing through it, and I think with more information in hand, we can do a much better job of ensuring that the participation keeps growing and that our reach keeps growing. So with that today, I couldn't be more delighted to be here. I'm really anxious to be part of this conversation, and I know we're going to leave here today with some very actionable steps to continue working together. So thanks for having me.
I'm Jim Alexander. I'm a consultant, have been for 30 years. I help foundations and corporate giving programs and families give away their money to charity. We're here in a very favorite place for many of our clients, and I'm delighted to be a participant in this panel. When we planned for this program, and there was a lot of pre-planning, one of the things that we did not discuss was everyone had to have a gray uniform on. And here we are, all gray. So I don't know that that reflects the tone of this issue, that there are no bright spots, or that's just how it is on this Chicago day. I'm supposedly going to offer solutions, and I don't know if the money man is the answer man, but I do have a solution, and I'll share it with you. Tomorrow, my 18-month-old grandson is coming to visit me for 5 days, and he's in trouble after this presentation. He's going to get more serve and response than he ever knew, and my God, are we going to eat well. So that's my personal action plan for tomorrow. What I have done with our clients over the past several years is to look at this issue. Many of you know about CLOC, the Consortium to Lower Obesity in Chicago Children. We founded that. I'm the godfather of CLOC. Kathy Christoffel is the godmother. And in 2002, we looked at the issue of obesity and children's health and recognized that we had very few tools to remediate, so prevention was the best strategy. And since 2002, we've been building this organization. It's a national model. In fact, it's an international model of which we're quite proud. The best part about CLOC, in my view, is that it is a very big tent. And we created something that excluded nobody. At the beginning, I insisted that a lot of our former clients who were food companies be at the table because I thought they had something to offer in the conversation. The doctors and the nutritionists who were organizing CLOC didn't think that was a great idea. McDonald's will bury us in a day with their marketing budget. How could we sit at the table with these guys? They're the bad guys. And I went to my friends in the food industry and they said, we are not going to sit with the enemy. We do not want to have a food fight. We're not going to change what we do. We're not going to participate. And yet they listened. We got everybody into a room, we locked the door, and told them, you are going to disagree, but we're creating a safe space to talk. And there will be no reporters in the room, but you will get to know one another, and you will get to know the issues, and you'll work on these, and we'll come up with solutions. And in fact, in the intervening years, we've had a wonderful collaboration. And in part, you've seen the shift in attitudes. We know that obesity prevention is a very complex problem. And so the evidence has suggested that we need to do several things. Part of it is what we're talking about today. Change the way people have access to food. Then change what is offered to them. Then market in a different way. So the people from Quaker Pepsi listened, and if you look at what they're offering for you to buy in the shelves today, it's very different than it was from the days in 2002. The vending issues in Chicago have shifted, not because vending machines are different, it's that the market is different and the awareness and the responsibility level is different. So the Chicago Public Schools change the way they use vending machines and what's in them. The Park District is about to do the same thing. The City of Chicago is changing licensing standards for early childhood daycare providers. We are working at a variety of levels to change all of this. And what we're also learning is that we must work not from the adipose rebound of 3 to 7, but now we're focusing on 0 to 3. And that's where the relationship with Diana and the Ounce and her network become very much more important than we thought about in 2002, because it gets too late. What we've learned in Chicago is that children are going to school overweight at kindergarten. They're twice as overweight as other children in the nation. So we need to reflect and refocus. And what Louise is doing with Chicago Public School food system is important, it's critical. But we have to start at an earlier age. And it's a community solution and it's a parental environmental solution. What we've learned with CLOC is that education and awareness are critical. Nobody wants an unhealthy baby. How do you get a healthy baby becomes a challenge. When we do focus groups with parents, families didn't realize that their child was overweight because overweight's the new normal. And they didn't think that a chubby baby was not a healthy baby. So we've changed those attitudes, and once you have that awareness, the next question is, well, what can I do to make it better? And that's the hard part. We know about food deserts, we heard about access to healthier food, and we have to figure out ways to address that problem. And the Food Depository certainly has been part of that solution, and we've worked to fund them. But from the solution point in terms of grant making, we're followers, we're rarely leaders. So it's incumbent on the nonprofit sector to design new ways to address these issues. And I think it should be messy. CLOC is not an organization with clear distinctions between this group and that group. We're all working together to try and figure out how to build an environment where children will be healthier. And it's complicated. It's the park and the why and the school and the home. And it's what you market and what you buy, and then it's what you eat or not. There are many places for choice, and we're trying to offer options at a variety of levels.